You got it?
That's not even recording. You want to do a practice run?
Oh, okay. Hi everyone, my name is Marissa Torchari and I am a registered dietitian and also a functional nutritionist. And I work here at Resilier Health. I've been practicing functional nutrition for a little over 12 years and I've worked in many different areas, but really have found that working in a more whole person setting, so marrying the holistic side in with the evidence of what the science says about nutrition and the disease process was really an area of nutrition that I like to work with my clients. I really believe that everyone is an individual and unique in their own makeup, and therefore when I work with you, we really need to treat you as an individual when it comes to making the best nutrition recommendations. And we are what we eat, right? So if we put bad food into the gas tank, we're not going to get great outcomes. So I work with all types of individuals, whether they're looking to reduce chronic illness or just looking to eat better and prevent diseases later on in life. But all of my patients have some things in common, have one common theme, and that commonality is that they want to feel better and they want to enjoy food again. Enjoy food from a taste standpoint, but also know that they're making the best decisions possible when it comes to their health. And I've learned this over the years, working both in outpatient care, but also one-on-one in the hospitals, and I've seen so many different types of people. So I really do believe that everyone has their own unique footprint, and with that, you need to have your own nutrition prescription. Okay. Yeah, totally not what I want to say, by the way.
No, that's fine. Do you want to get into more of an interview style, or would you like to do it again?
No, I want to do that one again.
Okay.
So probably what I should do is not, see, I was going to initially talk about my background and my studies, but what I need to do is just like introduce myself and say that I work here at Resilier Health, and then like what I probably like my ideal, right? Like your ideal client, and like who do you work with, I guess? And then talk about background. Would you suggest that? Talking about like my schooling, or no? Kind of leave that for.
I personally have hardly been listening. I've been focused on the technology.
Okay.
But I'm thinking to myself, if I was put on the spot and I had to have a go-to place, I would just think, I personally would just go to, why do I love what I do? Why do I care so damn much about what I do? And how am I trying to help people? And why do I see, why is that rewarding?
Okay.
That's me.
Okay.
Anyways, if that helps.
Okay. I agree with that.
Keeps me honest.
I like it. Okay. So.
You're making me nervous.
Whenever you're ready.
Okay. Hi everyone, my name is Marissa Torchari and I am a registered dietitian as well as the functional nutritionist here at Resilier Health. I have been here with Resilier working as the integrative nutritionist, so I kind of marry the holistic side of nutrition also with what the evidence and the science says about nutrition. And I work with all of my patients individually, meaning that everyone is unique in their own way. And I fully do believe that certain aspects of food one food may, no, I need to start over. So, okay, can I just start over? You're not like rolling in, you'll just edit out. Okay. Perfect. Hi everyone, my name is Marissa Torchari. I'm the functional nutritionist as well as registered dietitian here at Rensselaer Health. And I work with all different types of patients, but when I work with my clients, I marry the holistic side also with what the science or the evidence says about food, disease, and overall nutrition. And so I also like to think of myself as a food counselor, because a lot of what I do is talking about the behaviors of foods, meaning why do we choose the food that we choose? Is it because of taste? Is it because of what we're used to eating? Is it because of what's available to us in our environment? And I really love working with individuals, with families, because I like to think of it that food does change lives. Food should be something that's enjoyable, but it should also be something that nourishes us from within. So my approach when I work with any patient is that food is medicine. Food is part of your medicine. It's part of getting better, and it's a big foundational piece to that puzzle. And one of my main goals when I work with patients, the common themes are that they tell me, you've mended the belly pain that I was having, or the discomfort that I was having, or I really feel as though nutrition has been helping in my symptoms that I'm experiencing, and eating in this new style is helping. Or some of the other things that I hear is, I really feel though I'm taking the bull by the horns and using food to help prevent X, Y, and Z disease that I was susceptible to because of my genes or my background or whatever the case may be. So I really enjoy working with people and helping them discover how wonderful, healthy, and fresh food can be. Not just enjoyed, but also how we can eat healthy and feel good about it. And I want to talk a little bit about inflammation and how nutrition can be either a food that heals, or a food that also foods that can lead into more of body inflammation. So we think about what is healthy eating, and so many times when we're choosing foods, especially certain, you could probably just edit that out because I haven't really thought through that whole thing.
It's all right. While we have the second, do you mind stepping to your left a little bit?
Sure.
A little bit to your right. Halfway. A little bit to your left. All right, about there. How about another step? Little half step to your left. There you go.
Half step.
Perfect.
Okay, so I was talking about, how I work with people, talking about, stomach discomfort and reducing disease. Just trying to think.
Would it be more comfortable for you to pretend like I'm your client?
Yeah, maybe if you ask me some questions.
Okay.
Or just,
I
don't know. Trying to think of, in the introduction, I was going to talk, about, maybe I should just mention my background.
Sure. So.
And what brought me to Rensselaer?
Yeah.
Okay.
Or.
Okay.
I would say what brought you from the conventional way of eating and living to this new perspective.
Okay. So that's a great question. So when I work with my clients, I really like to reinforce to them that foods also can be very healing, but they can also lead into certain diseases. And I experienced this in my clinical work when I came down here originally to Florida, and I started working as a manager in a hospital. And I was looking around at what was being served to the patients and just thinking to myself that this is not why I became a nutritionist. These foods that were being served to the patients, I did not feel as though that they were helpful in any way, shape, or form in providing the nourishment that they needed to really get better and heal. And I said, I can't do this anymore. This is not what I believe. So I think from working in a hospital setting, it just really kind of showcased to me that I really would like to work in a approach that I could do a whole lot more education and really work with people one-on-one on changing their behaviors as it relates to food. Not just showing them what are the healthy foods to eat, but also giving them more and more information about prevention of certain illnesses. And a lot of that has to do with the foods that they were choosing. Maybe they thought that they were eating in a healthful way, but in fact it was feeding into their symptoms. So anyways, after working in that setting, I decided that I was going to go into a private practice setting. And in that way, I'm able to work with all of my clients on independent basis and get down to the level that they're willing to work. So if whether you come in and you know a whole lot about nutrition, or you feel as though you really need to get some of the foundations, I work with people at all different levels, and I provide people with, not just meal plans. It's not just about sticking to, what's on a piece of paper, what should I eat for breakfast, lunch, dinner, and snacks. It's really also about, understanding what healthy shopping looks like, understanding what foods you feel best with eating. And also, a lot of my clients have symptoms. So, we work on dealing with their digestion issues. And sometimes it's about, taking foods out and adding them back in. Or also, I have a lot of people that are looking to approach a new way of living because they're scared of coming down with diabetes later in life. They're scared about coming down with Alzheimer's later in life. And so on the preventative side, I see so many people now that are really driven to lead their healthiest life and their best life. And so I really just enjoy what I do on the, in the office, because working one-on-one with people is really rewarding and seeing that change happen.
Marissa, I thought food was to make me not hungry. How does it heal? How can it help my body?
So we actually can use food. If you think about it, food we require food. It's almost like a code for our bodies, okay? And it's special codes that tell our genes to turn off and turn on when they're supposed to, so that they can talk to all the different cells in your body and work the way that they should. And so by using food to nourish your body in hopefully what would be the best way possible, you're really going to be turning on all those systems. Your body is like a big machine, and when you feed it the fuel that it needs, it's going to be working appropriately, or the best way possible. So you want to think about it, that food is supposed to fill you. It is supposed to taste good. It's supposed to be enjoyable. But it's also supposed to be something that turns on all of those reactions to happen and give your body what it needs to work right.
So, how is it possible to continue enjoying my food as I'm also using it to heal myself? How do you do that?
Absolutely. So when I work with patients, I would I like to find out, what are the foods that you enjoy and what are things that you're absolutely not willing to eat. And a lot of people tell me that they think that eating healthy is, it tastes like cardboard or it's bland. And my goal is to get people, back in the kitchens and comfortable with preparing their own food. So you can do that by, you asked me, how can I make my food taste good? Well, I think it's also about, knowing some foundations of pairing, let's say foods together, as well as other things that can make them taste good, like seasonings, right? We think about, herbs and all kinds of seasonings that not only can reduce diseases because they help to actually reduce the inflammatory response in the body, but also they can help bring life to the food and bring flavor. So I work with a lot of people in that way in the food pairings, and then also I'm talking about food techniques. How do you prepare your food? And so getting back into the kitchen is part of that, and then realizing that in today's world, we need to, we're on the move, and preparing food is sometimes difficult. So also how to navigate shopping, in the grocery stores, and how to navigate finding healthy foods when you're looking for restaurants.